friends, how are you? Welcome to my YouTube channel D&D Pathshala. In this video, we will discuss regarding the drug of the day, Clinidipine. So let's get started with our video. In this video, the most important note is the drug information provided in this video is just for educational purpose and for providing knowledge. If anyone used this drug without doctor's advice by seeing this video, and if you face any kind of problems by this drug, then it is not our channel fault or responsibility for the person who took the drug. So please be careful. Now coming here to the JNC8, this JNC8 means Joint National Commission Guidelines. This JNC8 is released in 2014. So the new guidelines according to the classification, the BP, that is the blood pressure. So the normal blood pressure means the systolic by diastolic. So if the normal blood pressure is equal or lesser than 120 by 80. The 120 is systolic blood pressure and 80 is the diastolic blood pressure. So if it is lesser than or equal to 120 and lesser than or equal to 80 in DBP, that is diastolic blood pressure, SBP means systolic blood pressure. So if this is the range, then it is the normal blood pressure. Now coming to pre-hypertension, if the systolic blood pressure is from 120 to 139 and if the diastolic is from 80 to 89, then it is considered as the pre-hypertensive stage. Now coming to the stage 1 hypertension. Stage 1 hypertension means it is the moderate stage. So coming here to the stage 1 hypertension, if the systolic blood pressure is ranging from 140 to 159, that is SBP, systolic blood pressure, and the diastolic blood pressure, if it is ranging about 90 to 99, then it is considered as the stage 1 hypertension. And stage type of 2 hypertension, if it is greater than or equal to 160, that is the SBP, systolic blood pressure, and if the diastolic blood pressure is greater than or equal to 100. So if this is the range, means 160 by 100 or greater than 160 by 100, then this is the stage 2 hypertension and it is most severe type of stage. So these are the classifications of the BP, that is the hypertensive stage. So in one single word, the hypertension is defined as the elevation of the systolic blood pressure and the diastolic blood pressure. Now coming here, this is the classification of the antihypertensive drugs. So coming to the first class, that is the diuretics. The diuretics are of three types: thiazides, high ceiling, aldosterone antagonists. So coming to the examples like hydrochlorothiazide, furosemide, spironolactone, and RAS system inhibitors, that is the renin-angiotensin system inhibitors. So these are ACE inhibitors, AT1 blockers, direct renin inhibitors. Examples are captopril, lisinopril will come under ACE inhibitors. And coming to the ARBs, sartans like losartan, candesartan, and direct renin inhibitor is aliskiren. And coming to the third classification, sympathetic inhibitors. So these are of beta adrenergic, alpha plus beta adrenergic, and central sympathetolytics. So coming to the beta type of blockers, they are propranolol, metoprolol, and alpha prazosin, terazosin, alpha plus beta labetalol, carvedilol. So these are some of the examples. Coming to the central sympathetolytics, clonidine, methyl-dopa. So these are some of the classes, and the remaining classes are calcium channel blockers. So the calcium channel blockers is also act as a first line type of antihypertensive drug or agent, that which is prescribed for the patient. So these calcium channel blockers are of again three categories: phenylalkylamine, benzothiazepine, dihydropyridines. So examples are like verapamil, diltiazem, and dihydropyridines like nifedipine, clinidipine, lasodipine. And vasodilators examples are hydralazine, minoxidil, nitroprusside. These will be coming under two categories. They are arteriolar dilator and these are arteriolar plus venodilator. This nitroprusside category comes under arteriolar and venodilator. So these are some of the categories and these are the classifications of the antihypertensive drugs. So our drug, that is the Clinidipine, will be coming under the category calcium channel blocker, and in that calcium channel blocker, dihydropyridine. So this is the chemical structure of the Clinidipine. So these are the hydrogen atoms, nitrogen and the oxygen atoms. So this is the chemical structure. Now coming to the chemistry of the clinidipine, it was jointly developed by Fuji Visra Pharmaceutical Company, Japan, and Ajinomoto and Japan. So this was approved in 1995 year. And this drug is approved in China, Japan, Korea, India, and several countries in the European Union also. So this is the some of the history regarding the clinidipine drug, and its molecular formula is C27H28N2O7, and its molecular weight is 492.5 gram per mole. So these are the molecular formulas and molecular weights. And coming to its IUPAC name, it is 3-O- bracket 2-methoxyethyl 5O E 3-phenyl prop 2-enyl 2-6 dimethyl 1-4 3-nitrophenyl 1-4 dihydropyridine 3-5 dicarboxylate. So this 3-5 dicarboxylate. So this is the IUPAC name of the clinidipine. And coming to its melting point is 110 degrees Celsius. So this is the chemistry regarding the clinidipine. Now coming to the brands of this clinidipine, there are some of the brands like Silday, that is in the dose of 10 mg. So all these brands are of 10 mg, and Silday by Cystopic Company, Silacar 10 mg by JB Chemicals Company, Silogard by Cipla Company, Rancil 10 mg by Sun Pharma Company, Silagio, that is also 10 mg by Abbott India Company. So these are some of the brands regarding the clinidipine drug. Now coming to its pharmacological information. So this drug will be belonging to the 4th generation calcium channel blocker of the antihypertensive drugs class, and the other classifications are like dihydropyridine calcium antagonist, blood pressure lowering. So these are also known as the blood pressure lowering or normalizing agent. So these blood pressure lowering or normalizing agents will be coming under the brief type of classification. So first, blood pressure lowering agents or the normalizing agents, that can be also said as antihypertensive drug class. And in that antihypertensive drug class, this calcium channel blockers, and that the 4th generation will be coming under. In the 4th generation, one of the drug is clinidipine. Now coming to the uses. So these are used, that means this clinidipine drug is used for hypertension, and also for the management of hypertension, for the end organ protection and treating of the angina, that is the chest pain, and mostly in some of the rare type of cases or in the drug type of cases like cyclosporin induced hypertension in the renal transplant recipients, means who are going or who are being undergoing any kind of renal transplantations, if they face any kind of immunosuppressant induced hypertension like cyclosporin induced hypertension, then this clinidipine is also mostly used. And coming to the other informations, it is also reported as a use, means it is also reported as a drug for the use in the elder people with the conditions like diabetic nephropathy, and in the diabetes mellitus, and in the albuminuria condition. And mostly in the CKD cases also, this clinidipine is showing its increased use. Now coming to its available strengths, it is actually available from 5 mg, 10 mg and 20 mg. So these are the available strengths. Now coming to the mechanism of action. So the mechanism of action means it will be inhibiting the L-type channel and N-type channel. So there are actually 3 types of channels. In 3 types of channels, this clinidipine drug will be inhibiting L-type channel and N-type channel. So L-type channel is long-lasting current channel, and N-type channel is neuronal type channel. So how this will be actually acting means, it will inhibit the long-lasting current channel, that is the L channel. First of all, it will be blocking the incoming calcium, means the receiving calcium. So first of all, it will block the incoming calcium, and after the blockage, it will suppress the contraction, means the blood vessel suffering the contraction, so it will suppress that contraction action. So after the suppressing of the contraction of these blood vessels, so by this type of flowchart, so first of all blocking the incoming calcium, then suppression of the contraction of the blood vessels. So after these two process occurs, the final result will be the blood pressure will be decreased and it will be in a normal condition. And next one is it will be inhibiting the N-type channel. So this N-type channel is the neuronal type of channel. So this channel is actually located at the end of the sympathetic nerve. Now coming here at the end of the sympathetic nerve by the inhibition. So how it will be inhibiting means it will inhibit the release of the norepinephrine. So by inhibiting the release of the norepinephrine hormone, by here after the inhibition, same, it will suppress the increase of the stress. So the stress will be increasing because of here. The stress increasing will be suppressed by the inhibition of the norepinephrine. As the norepinephrine release is inhibited and the stress increasing levels means the suppressing levels will be decreased. So by the suppression, the blood pressure decrease will occur and it will become into a normal type of range, means 120 to 130 range. So these are the mechanisms, the L-type mechanism and the N-type mechanism of the clinidipine. Now coming here, the pharmacokinetic information regarding the clinidipine drug. So the pharmacokinetic information regarding the clinidipine drug means this drug is orally well absorbed and the peak concentrations can occur between 1 to 3 hours and the low bioavailability. So this low bioavailability means it is in a range of 13%. So why this low bioavailability is seen means because of its high lipophilic nature and low aqueous solubility nature. And these are the ADME parameters. In this ADME, the A is covered, that is absorption. Now coming to the distribution, it is high in liver, kidneys, plasma and tissue. And this drug is also having a large volume of distribution. And coming to here, the metabolism. So this metabolism means it is actually done by both the liver and the kidney. So in the liver, it is actually rapidly metabolized by the liver microsomes by a dehydrogenation process. So by the dehydrogenation process, here the most or the major type of enzymatic isoform that which is involved in the dehydrogenation process of the clinidipine. So this dehydrogenation process will also occur at the dihydropyridine ring. So the major type of enzyme that which is involved is CYP3A, that is cytochrome P3A. So this is the metabolism. And next, when coming to the T half, that is the biological half-life. This T half is about 20.4 minutes. So the clinidipine T half is 20.4 minutes. And coming to the excretion, its excretion range is about 20%. It will mostly these calcium channel blockers are very highly excreted, means they are having a very good excretion rate. So 20% will be excreted through the urine and 80% will be excreted through the feces. So this is the pharmacokinetic information of the clinidipine. Now coming to the adverse effects and the contraindications. Commonly, the adverse effects and the contraindications in the calcium channel blockers will be more. But when compared to the other classes in the calcium channel blockers, the dihydropyridine class, means this clinidipine class type of drugs are having less type of side effects. Means I am not saying that these classification will not be having any kind of side effects, but rather when compared to the serious type of causing side effects, the dihydropyridines are safe and mostly these are not contraindicated and these are also not given in such type of conditions or rare type of conditions. Means the side effects are less when compared with the other classes. So some of the common type of the side effects of the clinidipine drug are headache, fatigue, nausea, swollen ankles, flushing on the extremities or on the face, abdominal pain, palpitations, dizziness. So these are some of the common type of side effects. And when coming to the serious type of side effects, severe fatigue, skin rash, hypotension, eye pain, depression. So these are some of the serious and very rare type of side effects that which can be seen through these drugs. Now coming to the contraindications, hypersensitivity and cardiogenic shock, unstable angina, heart failure and severe aortic stenosis, means severe narrowing of the valves. So in these conditions, this drug is contraindicated. And coming to the interactions, there are so many drugs that which are not able to interact with this drug, like quinidine, phenytoin, erythromycin, acarbose, amiodarone, amphotericin B, carbamazepine, celecoxib, clonidine, dalteparin. Like some of the drugs will be giving with this drug, means if such type of example, like if carbamazepine or if phenytoin are given with the clinidipine, their action may decrease because of this drug, or the clinidipine's action may decrease because of these drugs. So such type of interactions are there, and some kind of drugs may also produce toxicity. So these are some of the side effects and contraindications and interactions. And the pregnancy category is not actually available, and it is not given to this drug. Means actually, if the pregnant lady are to be taken this drug, then they must consult their physician before taking this drug. So it is better to go for a physician option. So mostly the dihydropyridines are safe for a normal patient or normal person to take when compared with antihypertensive category, as they are blocking both L-type and N-type channels. Most of the calcium channel blockers will be blocking either L or N. But this calcium channel blocker, that too dihydropyridine calcium antagonist clinidipine, is being blocking both L-type, that is the long-lasting current channel, and neuronal channel. So this is safe when compared with the other calcium channel blockers of these classes or with the other classes. So these are the adverse effects and contraindications. Now coming to the patient education. So we have to tell the patient to take the drug regularly, and we have to educate them regarding the side effects, and don't administer the drug in a overdose manner. Means some of the patients may take their drug if they are very highly in an angry situation. They may think that they are having high BP, or that their BP is increasing. They should take their BP tablet. So many cases will be appearing in like these type of conditions. Means I am getting so angry, I think my BP levels are increasing, I should take my BP tablet. It's a completely wrong, and it's a completely lame type of manner. You shouldn't take that. If you are angry, that your BP is increasing. In so many conditions, the BP will not get increased. The drug should be taken as prescribed by the physician and as directed by the pharmacist. So you shouldn't take or shouldn't administer the drug in a overdose manner. That is the most important point, that you should educate the patient. And also educate the patient to go to the hospital and report to the physician or the pharmacist if the side effects are not decreased or not controlled. So this is the must step. And we should also tell the patient to take the tablet with a glass of water or with a glass of milk. So if we take with a whole amount, or if we take with a glass of water, so it will be easy to pass the tablet through the food pipe. If we take with small amounts of food or small amounts of water, the tablet may get stuck. So to avoid such type of conditions, we should take with a full glass of water. So this is mostly prescribed by the physicians and also by the pharmacist to the patient. So we should tell the patient to take the tablet with a glass of water. And if you miss a drug dose, so mostly don't miss these drug doses. Means as these are dealing with the blood pressure, we shouldn't miss the drug doses. But by chance, if you miss a drug dose, then you should ask your physician or pharmacist for the further action. So these are the patient education points. And thank you so much for listening to my presentation regarding the drug, that is the clinidipine. And you have related any kind of doubts, means if you have any kind of related type of doubts regarding the clinidipine or regarding any kind of previous videos, comment me in the comment section below. And if you like my video, like, share, subscribe, and please comment to my videos regarding the doubts, and please subscribe to my channel and support me. And thank you.